Welcome to Pharmative Live. I'm Dr. James Partyka. I'm a clinical pharmacist, oncology research scientist, and the founder of Pharmative. Pharmative is all about connecting patients to healthcare professionals and scientists in order to educate ourselves and to improve your healthcare and your family's healthcare as well. And that's Pharmative Live, and we're coming to you live from Palm Springs, California. So today's topic, this is our time to interact with each other. So you can either text me live or you can send your questions ahead of time to info@pharmative.com. And we do have a question from Judy today. And Judy from Florida writes, why is everything so complicated in medicine? Now that's a loaded question. And that's a question that I'm going to try and focus and narrow so that we can better understand how information is evolving in healthcare. Okay, so the title of today's topic forum, and again, I welcome your texts and I welcome your feedback and comments through info@pharmative.com, is that we're specifically going to talk about using information and technology to improve your healthcare. All right, so before we begin, we're sponsored, Pharmative Live, by Pride Nation Radio, which is the #1 LGBTQ dancing music station in the nation for several years in a row. Pride Nation Radio is actually streamed live from Palm Springs, California, and it has great dance and workout music. You can access Pride Nation Radio through our PNN1 Mobile Plus Health app, which you can download at your Apple and Android stores today, or you can just type into your web browser pnn.fm, or you can ask Alexa, play Pride Nation Radio. We're also available on TuneIn. And so, again, Pride Nation Radio is offering a special advertising rate for a 15 to 20 second rotating spot ad per month, $195 per month, and you can cancel at any time. That's Pride Nation Radio with affordable advertising throughout the nation, but also throughout the world. You know, as more people are moving to Palm Springs or visiting Palm Springs, they certainly want to visit your cafe, your businesses. There's certainly a lot of new housing construction ongoing in Palm Springs. You know, as you know, Palm Springs is the place to be. And Pride Nation Radio offers national advertising through live streaming over the internet. Throw away the terrestrial radio, as it's limited to just the Coachella Valley, and advertise with us at Pride Nation Radio. And to get more information on that, just email info@pnnmedia.com. That's info@pnnmedia.com. You know, sometimes I feel like I'm talking like a robot, but with all these acronyms and .coms, addresses, and so forth. And that's part of medicine as well. We have a lot of Latin abbreviations, and we have a lot of medical jargon. But when it comes to brass tacks, anyone can learn a little bit about medicine and healthcare. And that's important so that you can make informed decisions with your healthcare team, with your pharmacists, with your doctors and nurses. So that is our sponsor for today. I'm going to give you a brief update on COVID-19. We have 3 FDA approved for national emergency use vaccines for COVID-19. We have the Moderna, we have the Pfizer-BioNTech, and we have the new Johnson & Johnson, which is a one-shot vaccine, which is a big advantage for many people, especially those people that are in rural areas. All of the vaccines are safe and efficacious, and we have no data comparing one vaccine to another. And they were conducted over different periods of time in different populations. But the bottom line you need to know about the efficacy of these vaccines is all three will prevent moderate to severe COVID-19 disease, and they will reduce hospitalization rates practically down to zero and reduce mortality as well. So you want to get vaccinated. We know about the short-term complications of COVID-19, and some of the long-term complications include heart toxicity, lung toxicity, neurotoxicity in the form of what people refer to as brain fog, which is confusion, fatigue, loss of appetite, loss of smell, clotting disorders. So we want to get the vaccine to minimize your risk of developing COVID-19 coronavirus, and reduce morbidity and mortality. And we also want to be responsible to get the vaccine so that we minimize the risk of spread of the disease, not only in the United States, but throughout the world. So it's important to get vaccinated, not only for yourself, for your loved ones, but also for your community. Okay? Decreasing the spread of disease decreases the ability of the virus to mutate. Already we have identified several mutations of the virus which are more contagious. More contagious meaning easier to contract the disease, therefore it means more morbidity and mortality. But also the mutations possibly could mutate into a more deadly virus form. So again, we want to crush COVID-19, and we're going to do that in two major ways. One is when it's your turn to get vaccinated, and you can get that information through your local public health state officials and local news. When it's your turn to get vaccinated, when you meet the age criteria and the other criteria such as the type of work that you do, comorbidities, you want to make your appointment to get vaccinated as soon as possible. And it's easy to do. You can either do it online through various websites. I have a friend that did it through CVS.com, was able to schedule a vaccine appointment very easily. And at the time they scheduled the first vaccine, they scheduled the second vaccine. Now remember, Moderna is 2 shots. Pfizer BioNTech vaccine is 2 shots. And the J&J vaccine is just 1 shot. Okay, and it's going to take at least 2 weeks after your last dose to be fully immunized against COVID-19. So that's one way we're going to crush the virus. The second thing, we are going to continue to wear masks, practice social distancing, avoid large crowds, especially indoors. We're going to stay as much as possible at home and be safe, and avoid, large, crowds and, parties and things of that nature. Even once you're vaccinated, you're going to continue to practice masking up. It is a federal ordinance to wear a mask in federal buildings and on airplanes. And in many states require you to wear masks in public. Many businesses require you to wear a mask, and masks are available everywhere. If you don't have a mask, I'll send you a mask. But they're available everywhere, whether it's a cloth mask, a medical mask, or an N95 mask. We're going to mask or double mask up is even better, again, at reducing the spread of disease. If we reduce the spread of disease, then that decreases the likelihood of mutations of the virus. Again, we're in the middle of a pandemic, which is around the world, right? And this is no time to be listening to public officials who say we're open for business and you don't need to wear masks. absolutely wrong and absolutely ridiculous of the governor of Texas to say such stupid things. I always say, listen to your doctors, listen to your public health state officials, listen to Dr. Fauci. And once you're vaccinated, you're still going to wear your mask and practice social distancing and wash your hands. Again, this is a highly deadly disease. It is even more, the mortality rates are higher in brown and black people in poor areas of the country. So you want to get vaccinated. It is safe. The only side effect that we monitor for are allergic reactions. Those have been very few. Millions and millions and millions of people around the world have received now one of the 3 vaccines, and we know that they're very safe. These vaccines do not cause autism. That is a myth. Even the flu vaccines have never been demonstrated to cause autism. These vaccines are safe, and they are, through science, developed by biotech companies to stimulate your immune system to produce antibodies to attack the virus. So if you're exposed to COVID-19, your immune system is armed and ready with lots of antibodies and immunologic cells and T cells to fight the virus from it being able to invade your body. So again, get vaccinated when your turn is up. It's easy to schedule online. If you need help with that, contact your son, daughter, your grandchildren, or call a 1-800 number. There are many numbers out there on various websites or in the news, on the TV or on the radio, to instruct you on how you can get your vaccine at a site which is located near you. Again, there are pharmacies around the country that are vaccinating right now. If you don't have a choice, you get the vaccine that they have available for you. You may have a choice between one of the 2 shots versus 1 shot. It probably doesn't really matter, except from point of convenience of a 1 shot. They all are efficacious in reducing morbidity and mortality associated through COVID-19. Extremely safe. And the best part of all is it's free. So get vaccinated. There's no reason not to get vaccinated. I was just talking to someone yesterday or the day before yesterday, a young man of 38, and he's one of these people who thinks he's so young and healthy, he doesn't have to worry about it. And if he gets COVID-19, he'll readily get over it. Well, that mentality is actually, I've tried to educate him, it's not the right mindset to have, because we don't know about the long-term side effects, long-term complications of having COVID-19. I just mentioned earlier a few of them. Okay, there may be unknown complications down the road. So get vaccinated. There's no reason not to get vaccinated. You are monitored for 15 to 30 minutes after you have your shot to make sure you're not having an allergic reaction. If you have a history of severe allergic reactions, you want to discuss that with your pharmacist or your clinician prior to receiving your dose. So that the appropriate measures can be in place in case you have, like say, for example, a severe allergic reaction, anaphylactoid reaction, anaphylaxis reaction. Those are extremely, extremely rare. So get your shot as soon as you can, okay? COVID-19. So now we're going to go on to one of my favorite topics, which is using technology in healthcare in order to provide you with information and to make it easier for us to maintain our health. Because as I always say, it's easier to prevent disease than it is to treat disease. So as you get older, or if you unfortunately were sicker as a child, or Human disease can happen from the moment you're born or in the womb. And so we want to do everything we can to prevent disease, and that has a lot to do with, avoid risky behaviors like don't smoke, only have 1 or 2 drinks per day at the most, avoid illicit drug usage, exercise, keep your weight down, try to eat healthy, and get 8 hours of sleep per night. That's really important for brain health. 8 hours of sleep at night. And if you download your PNN.1 mobile health app, you'll see there's a number of vital healthcare resource tools on that app, including Pharmative Live and Pharmative.com. But in addition to that, we have a meditation app, and it uses delta waves. And you just play this by your bed at night, and you'll drift off to sleep. Or if you still have problems sleeping at night, there are sleep aids available over the counter, but you can also discuss that with your doctor as well. It's important to get 8 hours of sleep at night, and that's what I strive for. Last night was 7, so I didn't do so well. Hopefully tonight will be 8, but it's hard to make the time, but it's important to get your sleep because it's important for brain health and brain chemistry, as well as your physical health as well. So again, let's talk about the changes in technology, all right? I think about 3 or 4 years ago, I talked about there's technology now which augments reality, and existing right now is artificial intelligence. I want to acknowledge some of the people we have out there. Is Harvey is watching, Helen, hi Helen, Jimmy as well, Steve, Alan, welcome to Formative Live. Text me your questions. Okay, we have about 10 minutes to go, and all of our Formative Live episodes are downloaded and available on Pharmative YouTube. They're also available on Pharmative.com under Pharmative Live. They're also available on your PNN mobile health app. See, it all intertwines together. And my vision of Pharmative and PNN media is that in the palm of your hand of a cell phone with a PNN1 mobile app, you'll not only have access to great Sky News and entertainment with retro TV, cartoons, and movies, and music, because you have Pride Nation Radio on your PNN1 mobile app. But you also have access to well-established factual medical information as well in the palm of your hand. So, and you can also play games, and you can Google and do weather, and all of these wonderful things with the technology that we have. And the great thing with technology is it's becoming less and less expensive. So I don't know of one person that doesn't have a smartphone, but I'm sure they still exist. But for many, many, many providers, you can sign up and get a free cell phone, a free smartphone. So now we're going to talk about technology, and I'm going to give you 5 examples of things that are very easy to do, very inexpensive to do. And I take into perspective people who may have limited access to their doctors. Either they don't have insurance, or they live in a rural area where there are not a lot of doctors and pharmacists around them to help them make their healthcare decisions. So that's one thing that inspired Pharmative.com, which was the first social media network dedicated to healthcare. So what does that mean? Pharmative provides educational materials. They're written in a lay language on practical information that is necessary to make informed decisions with your doctors and your nurses and your pharmacists and your technicians. So we lock down the content. It'll be locked down and labeled either as Pharmative or Pharmative Care Team. And in Pharmative.com, which doesn't accept credit cards, we don't charge for our services, All of PNN Media and Pharmative is paid by advertising dollars. We do not accept advertisement payments by pharmaceutical and biotech companies, and we do our best to have objective information. But in the Pharmative.com environment, you go to your main menu after you sign in, username, your password, you validate and confirm your email. You go to the upper right-hand menu and you select Find and Join Networks. And a menu, we have over 15 different healthcare channel networks, from anywhere from in tech and technology to cancer care and research to women's healthcare, men's healthcare, Pharmative Live, and many others as well. Senior living called Silver Linings is one of my favorites as well. And so once you join one of these 15 network channels, it'll populate your trending feed. The other great thing about Pharmative.com is that, and it works great on an iPad and works great on a laptop, and sometimes it's a little clunky on a cell phone, I have to say. It depends on how old your phone is. If you still have a flip phone, it probably ain't gonna work, okay? So, but one of the things also about Pharmative.com is we have a HIPAA compliant point-to-point instant messenger. So if you have family members that are located in different parts of the country or the world, you can instant message them about your healthcare matters. It's fully encrypted and no one else can read it. And that's my guarantee to you. That's Pharmative.com, and we don't accept any information. And one of the questions I got about Pharmative.com is, where's all this information going? Well, number one is, you only are required to have a username, a valid password, confirm your email, and a password. Anything else you type into Pharmative.com is up to you, all right? You're not going to be asked for a credit card or any financial information, a social security number, or any of that. It's really all about exchanging information between healthcare professionals and scientists, experts, with people like you out there. Okay, that's Pharmative.com. I have to explain that every once in a while because I know it's a little, the user information on the very main page before you ever establish a login. There's information about Pharmative and how to use Pharmative. And there's also links about privacy as well as terms. And there's a new link I'm working on, which is for frequently asked questions. So that's Pharmative.com. You should join today for free. People say they don't like the word free, but I do. I like the word free. Again, we don't accept credit cards. And all of Pharmative PNN Multimedia Group, which Jimmy Mann and myself are co-owners, is all free to the end user. And again, the monies that support Formative and Pride Nation Radio and PrideNation.com are made through advertising dollars, both local and nationally as well. So that's Formative and that's PNN Media. So number one on my list. I had this in one of my previous Formative lives, but it's one of my favorites. Okay, so I'll just share with you personally. Just about a year ago, I had high cholesterol. I had normal cholesterol all my life, but as you get older, now I had high cholesterol. So I went on generic. Okay, we always choose generic medication unless told otherwise by your pharmacist or your prescriber. Choose generic unless the brand happened to be lower cost than the generic. Like in the pharmacy, sometimes the brand goes on sale and so forth. And then if you want to pay extra money for a particular pretty packaged, different kind of dosage form, you know, there's so many different types of aspirins out there. I always actually use mostly ibuprofen because aspirin can affect bleeding and platelets. It's also caustic to your stomach. more so than the other non-steroidal anti-inflammatory drugs. But again, that's one of my messages always. Always choose generic unless otherwise told by your pharmacist or prescriber. So the first thing I wanted to let you know, so cholesterol, all right? So I have high cholesterol. So my doctor and I decided to start myself on generic Lipitor, okay? So we did that. And I didn't have an appointment with him for another 3 months or so, but I was kind of curious after 2 months if the medication was working or not. So you can go online, and I went to Amazon. I don't own any stock in Amazon, but I went to Amazon and, searched for cholesterol tests, and you can order an FDA approved cholesterol with a full lipid panel test online for $40, and you get it within a few days, and it's just a pinprick of your finger onto a swab or a patch. You send it in, and in 2 to 3 weeks you get your cholesterol and your lipid panels. Mine was 175 and with a high HDL, which was excellent. So I go into my doctor's office with my own laboratory report, because if you were going to go, one of the things that we got to get better at is reducing the costs of delivering healthcare, which are all the labs, the tests, the procedures, the redundancies, the fees associated with it, all of that are much actually gone up, much higher in cost by about 40%. And drugs have only gone up in cost by 4%. So, everybody blames, the costs of healthcare on medications, which are expensive because the research and development of drugs, each drug is over $1 billion. So that's where, and they're under a patent for a limited period of time. So in order, for the business people to get a return on investment, they need to come up with over $1 billion just development in one drug. And again, this is a little bit old information, but about 1 out of 10 drugs are only 1 out of 10 drugs are actually FDA approved. Okay, so 9 of those 10 drugs fail approval and are put on a shelf somewhere. So that's why drugs cost so much. But once they go off patent, then the generic drugs come out, which are FDA determined to be bioequivalent, or for biologic drugs, the term is biosimilar. So we choose the similar or bioequivalent generic drug because it's lower cost. Okay, so I get the FDA panel. Well, I go into my doctor's office and say, good news, my cholesterol level is 175. He wasn't too happy with me. He wasn't happy that I took responsibility for myself and did something legally to obtain my own cholesterol test. And he gave me a little bit of a lecture about, I manage you. I manage your medical management, not you. So anyways, we had a little bit of a laugh over that. So that's number 1 on the list. You can get an FDA approved. And why is that important? Because some people can't get to a doctor's office or a laboratory or a clinic, right? And we know that high cholesterol, right, increases your risk to cardiovascular disease and stroke. So we want our cholesterol levels to be under 200. Okay. Number 2 on the list are glucose monitors. You might see the commercials or the ads online. Those have really come such a long way. Whether you're type 1 or type 2 diabetic that is on insulin, you need to control your glucose levels, throughout the day. So you can take a patch. You place the patch on your abdomen. Sometimes it's on your arm. You take your smartphone, you touch it to the patch, and it gives you a glucose level immediately without having to go through, many pinpricks throughout the day to get that glucose level. It just touches your phone to the patch. You get the glucose level. It's under a certain level, and it's great. So for diabetics, very important to monitor your glucose levels so that we get the hemoglobin A1C under 7.5, which reduces diabetic long-term complications. So that's number 2, glucose monitors. Number 3 is a favorite of mine, is smartwatches, which can, and of course this is mine, I wear it almost all of the time. They have the ability to measure your heart rate. The watch that I have also can screen for atrial fibrillation and give me a warning. They measure your activity level. The watch that I have not only does that, but it also tells me when I should breathe, because deep breathing exercises reduces stress. So if you can breathe in for 5 counts and then breathe slowly out for 5 counts, and you repeat that for up to a minute, you can do it longer. It's actually better than medication to reduce stress and anxiety. And we know that stress and anxiety damages, decreases your health, basically, by, increasing blood pressure and so forth. So smartwatches are the way to go. You should get one. So very inexpensive now. Some of them directly measure the oxygen levels in your blood, and that's important as well, especially if you have a pulmonary problem. And that brings me to number 4 for technology innovation. And I recently recommended this to a friend who has pulmonary problems. Online, Amazon, or other places, you can get a pulse oximeter. Okay, and what that is it's just a little plastic clip that you place on your finger. And you can get this for between $35 to $40, right? One-time fee, right? And it's the most sensitive way of measuring your oxygen level. And generally your oxygen level should be above 95, but the baseline might be between 90 and 95. But if your oxygen level were to drop below 90, that's when you need to call your doctor, because that becomes an emergency situation, okay? In order for your organs and your brain to function, you need oxygen. That's why we all breathe. And a pulse oximeter, and you may have had this in a clinic. They use the same ones in the clinics or a hospital. Hospital might be a little bit more sophisticated, a little bit more accurate, right? But you just put the clip on. So this came up when somebody had COVID-19, okay? And when you initially get COVID-19, right, you get difficulty in breathing, right? And loss of sensation of smell and fever, and the infiltration in your lungs decreases your oxygen levels. Well, again, if it gets below 95, below 90, that's a critical level. So get a pulse oximeter, place it on you. This is also helpful for people that have COPD or emphysema or other pulmonary ailments. $35 to $40 on Amazon. You can't beat that price, okay? And they're fairly accurate. Not perfect, but they're fairly accurate. All right. And then number 5 on the list, of course, I have to say, is Pharmative.com, which I've already talked to you about, which is the first social media network dedicated to your healthcare. And that's by connecting patients to healthcare professionals and scientists like myself and others as well. So those are the top 5. So I just want to encourage people about information. It's not as cryptic as it used to be, where there were so many, Latin terms and big medical terminology being used. And it was almost like all the healthcare professionals were talking in, again, a foreign language that nobody understood, like OS, PRN, stat, all these terms that the healthcare professionals use to actually minimize the amount of time it takes to basically communicate in order to save lives. But now a lot of that information is actually just being written in common English language. And the reason is, especially like, say, a good example would be writing a prescription, used to be written in Latin, And there's all kinds of prescriptions. Pharmacists don't just count pills, they also mix and compound various formulations for patients, but they also provide information. They specialize in pediatrics and cardiology and oncology, nuclear pharmacists who provide radionuclides for various reasons and so forth. So there's all different types of pharmacists, community pharmacists, hospital pharmacists, FDA pharmacists. So get to know your pharmacists because they truly are the drug experts. They go to school on average in the United States for 6 to 10 years, and they truly are the drug experts. And they will oftentimes provide their services for free. They will look up the information if they don't know the information, because we all need to rely on computers and libraries of information because there's so much information out there. I'm going to add number 6 on the list. Go to drugs.com. Now, drugs.com, which is provided by the FDA, all the FDA approved drugs are listed there with their side effects and their dosages, but they also have a drug interaction checker. So because people go to multiple doctors and multiple pharmacies, the only way you can really get a complete drug interaction check is by you entering in either the brand name or the generic drug up to 9, I believe it's up to 9 drugs, and you press the button, okay, and it'll do it. And what you want to look for are moderate to severe drug interactions. And you take that information to your pharmacist to ask them about it, because it may be anything from changing one medication to another medication, or it may be spacing it out so that you take one in the morning and one in the evening. There are many different ways of which we manage drug interactions, and you can get that at drugs.com, which is also available on your PNN One Plus Health mobile app. So check that out. That's number 5. Now, my last thing on my list is something which is a little bit of a pet peeve of mine this weekend, is we all use streaming devices, and we all use television through cable or through Wi-Fi or through satellite dishes to obtain information, entertainment, but also medical information, news, which is helpful for you in making informed decisions. Lots of people that are out there. So I welcome all of you. Again, Pharmative Live, I tend to talk too much. So anyways, we're almost done here. So our feature article on our online magazine, which is located at pridenation.com, that's all one word, pridenation.com. Our feature article is on comparing streaming TV services, comparing the services and the costs, because I had a problem with a particular brand that will remain nameless. I wanted to discontinue the service. So the big companies like Comcast, DirecTV, Spectrum, I believe Verizon, Frontier Communications are all very, very, very expensive, right? So we're all looking to save a buck now and then, because of times are difficult for many of us, right? And we all, with the changing technology, can stream TV now on the internet. That may scare some of you out there, but many of you are probably already doing it. But this particular article is our feature article on our online magazine, and will give you a lot of great information provided to you via a company called Clark. And you can compare Hulu services, which provide TV and old sitcoms and stuff like that, and live TV as well, to other kinds of services like Roku and Sling. Now, Roku, PNN One, we are on Roku under the name of Proud TV and KLPS 19, and we are also on Chromecast. So you can get these streaming devices and you can a la carte your programming. Okay. Now that sounds scary to some people, right? But you could hook up with Dish TV. You can get a package for just $87 a month. And then you can, and with that, they have links to Netflix and links to the kind of streaming entertainment services you like as well. So it's always good to reevaluate how much money we're spending on information and TV and movies. And as we add all of these additional plus services like Disney Plus and Apple Plus and Hulu Plus and all of this, it adds up. The great thing about PNN Plus is it's free. And it's free on Roku and Chromecast. And you can even go to any internet browser and type in PNN.1 and you can get all of our entertainment for free online. Again, it's so important, again, to be on top of technology, reduce your costs, get access to information, understand that. When you have questions, you can always email me at info@pharmative.com. So that's everything we have for today. I always end by saying stay healthy, as it's easier to prevent disease than to treat it. Okay, so until I see you next time, have a great weekend and enjoy your day.